Hello and welcome. Thank you for joining me today for this safety and resilience training. My name is Hannah Neal, and I am the program coordinator for Prevent Suicide Today and Mindful Self-Compassion programs at Chatham County Safety Net Planning Council. I am also a volunteer crisis counselor through the crisis text line and have my master's degree in social work. And I'm here today to focus on suicide prevention using a public health approach. We at Prevent Suicide Today have been working in Chatham County, Georgia since 2017 in partnership with the Savannah-Chatham Public School System, Gateway Community Service Board, and other diverse community partners. Together, we are implementing evidence-based trainings, including applied suicide intervention skills training, or ASSIST, which you may have taken before, Safe Talk, Suicide Talk, Question, Persuade, Refer, or QPR training, as well as workshops in mindfulness and in self-compassion. And today's session combines elements from multiple evidence-based programs, which offers us a comprehensive look at school and community suicide prevention efforts. And while you are here as part of your mandatory job training, we would like to invite you to take care of yourself emotionally during this training. The subject of suicide that we're discussing today can be very heavy and triggering for some of us. So please feel free to redirect your attention or ask for help if you feel that you're becoming overwhelmed or feel any emotional discomfort. And this session today is aimed at the entire school community because we think that by working together, we can prevent suicide. And it is our goal for everyone to know that help is available and know where to find it. We hope that through today's session, you will recognize the need for suicide prevention and resilience, describe the public health parable, build an understanding of mindful self-compassion, learn how to take the first steps to help a person at risk for suicide, and finally contribute to safety and well-being in the community. So let's begin by looking at statistics which speak quite loudly and help us better understand the problem of youth mental health and suicide that we're facing. According to the latest report by the National Alliance on Mental Illness, or NAMI, suicide is the second leading cause of death for people ages 10 to 24. 1 in 6 U.S. youth aged 6 through 17 experience a mental health disorder each year. 13% of youth aged 12 through 17 reported suffering from at least one major depressive episode in 2019. And 46% of U.S. youth under the age of 18 have had at least one adverse childhood experience, and 20% have had at least 2 adverse childhood experiences. So the likelihood of students, faculty, or staff encountering a suicidal student is real, even at the elementary school level. Few events are more painful or potentially disruptive than the suicide of a student. There's evidence that suicide is preventable in many cases, though. Appropriate and timely prevention, intervention, and postvention helps school administrators remain control in a crisis and may actually help prevent a suicide contagion. In the classic public health parable, a witness sees a child caught in a river current. The witness saves the child only to be drawn to the rescue of more drowning children. After many children have been rescued, the witness walks upstream to investigate why so many children have fallen into the river. This story illustrates the tension between public health's protection mandates to respond to emergencies, like helping people caught in the current, and its prevention and promotion mandates, like stopping people from falling into the river. Evidence is mounting, though, that an upstream approach to health will actually benefit everyone. And the goals of prevention, or an upstream approach, in suicide response includes having the person stay healthy and well, helping people deal with life, preventing elements leading to suicidal thoughts, teaching tools for coping, and recognizing signs of self-destruction before they turn into suicidal thoughts. Intervention in suicide response includes recognizing the signs of suicidal thoughts, aiding the person at risk to find resources to help them deal with their problems, and implementing a safe plan with the individual. Postvention in suicide response includes caring for those left behind by someone who may have died by suicide, ensuring access to resources, and watching out for signs as you would in the prevention phase. So now let's explore how using mindfulness and self-compassion as prevention, or an upstream approach to suicide prevention, may be beneficial for creating suicide-safer schools. The benefits of mindfulness and self-compassion are both well-established and wide-ranging. Studies on subjects ranging from students all the way to Marines have found that practicing mindfulness reduces stress and leads to higher levels of well-being. The researchers found that people with higher mindfulness skills have greater resilience, thereby increasing their life satisfaction. Studies also show that self-compassion may protect against suicidal behavior due to reduced depressive symptoms and heightened engagement in wellness behaviors. Individual and campus-wide strategies promoting self-compassion and wellness behaviors may reduce suicide risk on school campuses. According to research, more people tend to feel compassion for others than compassion for themselves. In fact, around 78% of people actually feel more compassion for others than they do themselves. So you are in good company if you find this to be true. Self-compassion and compassion have different relations to a person's well-being too. People who practice self-compassion generally have fewer depressive symptoms, less negative emotions, and more positive emotions like curiosity, life satisfaction, and happiness. Self-compassion is also an antidote to really difficult emotions like harsh self-criticism and shame, which are often present when a person is struggling with thoughts of suicide. The effects of harsh self-criticism are that it can lead to depression, anxiety, and relationship problems and suicidal behaviors. Harsh self-criticism has been linked to eating disorders, self-harm, and body dysmorphic disorder. A tendency to criticize oneself leads to projecting negative beliefs onto others, often resulting in isolation and loneliness and a feeling of helplessness. And self-critical individuals often find it difficult to assert their personal needs and desires. So now let's take a closer look at the definitions and the meaning of self-compassion. Compassion is the courage to see the cause of someone's suffering and the willingness to alleviate it. So the willingness to see and respond to your own suffering is self-compassion. With self-compassion, you relate to yourself the way you would relate to a friend who is having a hard time. Through self-compassion, we become an inner ally instead of an inner enemy. So with self-compassion, we learn to speak to ourselves like a good friend. And the more complete definition of self-compassion involves 3 core elements that we bring to bear when we are in pain. And these are self-kindness, common humanity, and mindfulness. And each of these three core components is an important part of understanding self-compassion. Our first core component, self-kindness, literally means just being kind to ourselves and treating ourselves with care and understanding rather than with harsh judgment. When our life circumstances are challenging, with self-kindness, we actively soothe and comfort ourselves. Our next core component is common humanity. And common humanity is a sense of interconnectedness. It's recognizing that all humans are flawed works in progress, that everyone fails, makes mistakes, and that everyone experiences hardship in life. And common humanity is the opposite of isolation. When we remember that pain is part of the shared human experience, every moment of suffering is transformed into a moment of connection with others. And our last core component is mindfulness. And mindfulness involves being aware of our moment-to-moment experience in a clear and balanced manner. It means being open to the present moment, allowing all of our thoughts, emotions, and sensations to enter into our awareness without resistance and without avoidance. Mindfulness allows us to be with painful feelings as they are, without suppressing or becoming absorbed by them. You can think of self-compassion as a connected, loving presence. Connected being common humanity, loving being self-kindness, and presence being mindfulness. So now I'd like to teach you this very simple technique that can help you remember to practice mindfulness and self-compassion. And this is the PARC model. And P stands for pause. So just simply pause what you are doing in the moment and maybe taking a few deep breaths and centering yourself. A stands for ask. So now ask yourself, what do I need right now? And allow yourself to be open and honest with your answer. R stands for recognize. So notice any present sensations in your body. If you feel any tension or ache or discomfort. Identify any emotions you may be having, like anger, sadness, tiredness. And observe your thoughts and how they move through your mind. And K stands for kindly respond. So kindly respond to your needs by comforting your physical body or soothing your emotional body, maybe validating your feelings. Maybe you found you need to protect yourself from harm, motivate yourself, or provide for yourself in this moment. And this simple PARC model is just a really great exercise to check in with yourself and give yourself a moment to respond to your needs. So now let's move down the river and discuss the intervention strategies that can be used with a person who already has thoughts of suicide. Let's talk about suicide risk factors. So there is no one reason why people become suicidal. People become vulnerable to suicide really due to a combination of biological, social, and historical risk factors. And risk factors are characteristics or conditions that really increase the chance that a person may attempt suicide. People may experience painful, disturbing, or traumatic events that overwhelm the coping mechanisms they have developed. And we can examine 3 categories of risk factors that may increase the likelihood of a suicide attempt. Health risk factors may include a mental illness, such as depression, anxiety, or bipolar disorder, substance use, maybe a chronic illness or chronic pain, traumatic brain injury. Environmental or social risk factors include a loss of housing, financial crisis, maybe that includes a loss of income, relationship problems like divorce, bullying or breakups, unemployment, and the access to lethal means, especially the access to firearms. And historical risk factors like a family history of suicide, previous suicide attempts, or exposure to any traumatic events may also increase a person's risk. The truth is that people who attempt suicide are in a lot of pain, whether it is emotional, physical, or financial pain. They really just don't see a way out of this pain. They may feel overwhelmed, really lonely, or hopeless. And so our goal is just to offer hope and show that help is available to them. Now I'd like to talk about common suicide warning signs. When someone is contemplating suicide, they may show changes in the way that they talk, behave, or act. So most people who take their lives exhibit one or more warning signs. And it's really important to look for a change in behavior or the presence of entirely new behaviors, especially when these behaviors are related to a painful event, a loss, or a change. So someone thinking about suicide may talk about killing themselves or joke about killing themselves. They may say they feel trapped, are hopeless, or feel like a burden. Or they may talk about how much pain they're in or how tired they are. As a volunteer crisis counselor, one of the main things that I hear when someone is contemplating suicide is talking about how tired they are. A person thinking about suicide may also begin behaving differently. They may isolate themselves from family or friends. They may begin giving away prized possessions, maybe sleeping too much or not sleeping at all. They might become aggressive or start using substances like drinking or smoking unusually. And lastly, someone thinking about attempting suicide may have really major mood changes. They might become very depressed or anxious or agitated. They might feel shame or embarrassed by their thoughts of suicide. And on the other hand, they might abruptly start acting happier or more relieved. It's important for all of us to be aware of these common suicide warning signs to be able to intervene before somebody makes an attempt. And now I'd like to introduce a model that can help you remember the steps when intervening with someone thinking about suicide. And this is called the TALK model. And we can help meet the needs of someone at risk for suicide by using this TALK model. So let's first begin with T, and T stands for tell. So tell the person at risk for suicide that you noticed a change in their behavior, appearance, or mood. Let them know that they can talk to you openly. And remember that your reactions and attitude can influence the intervention. So be patient, persistent, and respectful. A stands for ask. So ask the question, are you thinking about suicide? It communicates that you're open to speaking about suicide in a non-judgmental and a supportive way. Ask the person directly, clearly, and as soon as you can. Asking in this direct, unbiased manner can open the door for an effective dialogue about their emotional pain and can allow everyone involved to see what next steps need to be taken. After you ask the question of suicide, L stands for listen. So make sure you take their answers seriously and don't ignore them, especially if they indicate they are experiencing thoughts of suicide. Listen to their reasons for being in emotional pain, as well as listen for any potential reasons they want to continue to stay alive. Help them focus on their reasons for living and avoid trying to impose your reasons for them to stay alive. And finally, K, keep them safe. It is important to find out a few things to establish their immediate safety. So ask follow-up questions. Have they already done anything to try to kill themselves before talking to you? Do they have a specific, detailed plan? What's the time of their plan? Do they have access to their planned method or means for suicide? Do they have access to drugs or alcohol? Who else can be involved as an appropriate helper? The more helpers that are involved, the better. And what other resources are available to you and to the person at risk for suicide? And can you help connect this person at risk for suicide to additional support and resources if you are unable to keep them safe? So let's continue moving down the river and start talking about postvention. Postvention refers to activities which reduce risk and promote healing after a suicide death. So although postvention is typically implemented after a suicide, it really is essential that we prepare for postvention before a suicide happens by training school staff and ensuring access to resources. Research has established that family members of people who die by suicide, this including parents, children, and siblings, are at an increased risk of suicide. They are often referred to as survivors of suicide. So picture a suicide death like a pebble dropped in a pond. So while the first and biggest waves hit the family and those closest to the decedent, the impact really spreads outward to others exposed to the death, like friends, witnesses, first responders, providers, and colleagues. A suicide death can affect those beyond the immediate loss survivors and ripple outward, impacting others and even impacting the entire community. And although they are rare events, suicide clusters and suicide contagion also provide examples of how exposure to suicide can increase risk. A suicide cluster is defined as a higher than expected number of deaths occurring closely in time and space. A suicide contagion is when exposure to suicide influences others, who are likely already at an elevated risk, to take their lives. Suicide clusters and contagion have been observed in schools, communities, campuses, military bases, and among a variety of different populations. So postvention is prevention. Suicide prevention efforts should include a comprehensive postvention component that reduces risk and promotes healing for the immediate family and reaches out into the community to support the broader group of loss survivors. Knowing your resources and where to find help is essential in suicide prevention, intervention, and postvention. So know your resources, like your Employee Assistance Program, or EAP. An EAP is a company-sponsored benefit designed to help employees and their families address problems that can compromise personal satisfaction and sometimes job performance. It's professional. Performance management counselors are fully licensed professionals who have clinical training and experience to help you and the members of your family. It's also confidential. Per the state and federal law, your use of the EAP is confidential. So that means no information will be shared with anyone without your written permission. And it's free and informal. So there is no charge to you or your family members for initial evaluation and brief counseling. If your problem goes beyond the scope of the program, you will be referred to resources that are covered by your insurance or based on your ability to pay. And the information for your Employee Assistance Program is at the top of the slide, the Lifestyle Management Group. So let's talk about some free community resources that are available to you. First, we have the National Suicide Prevention Lifeline, and that number is 1-800-273-TALK or 8255. You can also visit them at their website at suicidepreventionlifeline.org. And when you call that number, you will be connected to a volunteer crisis counselor who can contact emergency personnel or connect you to additional community resources or national resources. We also have the crisis text line, and you can text TALK or HELP to 741-741. And this is also free and confidential, and both of these services are 24/7 as well. And this is a really popular resource for youth and teens who don't feel like talking on the phone. The crisis text line can also connect you to additional resources nationally and within the community. And they can also contact emergency personnel if needed. Next, we have the Georgia Crisis and Access Line. They also have a website at mygcal.com, and they have an app, which is MyGcal, or you could call them at 1-800-715-4225. And they can send out emergency response teams to someone who is in a suicidal crisis. And all of these resources, again, are free, and they're 24/7. You can also visit your primary care provider, a psychiatric hospital, walk-in clinic, emergency department, or local urgent care center if needed. And these 3 resources that we have listed are available to use for someone who is a third party. So someone who is worried about a person in crisis can contact the National Suicide Lifeline, the Crisis Text Line, or GCAL. They will be connected to volunteer crisis counselors or professionals who can aid them in assessing for risk and connecting the person at risk with the resource directly. Knowing your resources also includes being familiar with your district's child abuse and neglect policy. Please take a few moments to familiarize yourself with this policy. This concludes our safety and resilience training. Please email us at assist@chlink.org. Give us a call at 912-661-0577, or like us at Prevent Suicide Today if you would like to see any further trainings we have in the community, or if you have any questions or would like to request a training. Thank you.